From doctors to nurses, they save lives on the front lines. But burnout and grief, healthcare workers say the pandemic has led to a crisis in mental health, and plenty are quitting. There's now a mission from two Valley mental health care providers to help healthcare workers heal.
We noticed that there was a cry for help. The morale is low. Back-to-back code blues. How do you process that?
The need was really compelling.
They've worked with first responders and survivors of 1 October, trained law enforcement agencies on crisis intervention and processing trauma. Through the pandemic, they've seen the people on the front lines suffering.
That was the birth of the Frontline Workers Support Group. It's become a virtual community. Never met any of the participants. And it's like I know all of them by now.
These Valley mental health leaders founded the COVID Frontline Healthcare Support Group, meeting once a week virtually since December, offering group counseling to healthcare workers. Denise Jackson Marshall founded the Trauma Recovery Center using Reiki and sound therapy. Johanna O'Flaherty is a clinical psychologist who's worked with groups of survivors of major airline disasters, including 9/11 survivors, and was also the vice president of the Betty Ford Center.
Nurses, respiratory therapists, chaplains, a few docs now and then. When they started, there was tears all over the place. They're exhausted. They have worked 12-hour days, and then they've been asked to cover another shift. Some of them have never missed a week.
I feel that we're really making an impact. What self-care looks like and how important it is to go get the massage, to go do the far infrared, do the Reiki, do the meditation.
The help is free and on their own time. The team says, though, this is just scratching the surface of what these frontline workers need. Their message: hospitals and healthcare systems should invest in mental health and trauma recovery for workers. The number of people quitting from burnout and grief is already a national crisis.
A strategic plan, a formalized plan. There are many teams like ours needed throughout the world.
These people are our lifeline. When we need to go to the hospital, we need someone who can take care of us. These people have been traumatized. They need to know they're not alone.
Dr. O'Flaherty says a similar team is being formed in Germany to help healthcare workers there.